Welcome back to the Dr. Rich channel. Today, we're talking about, am I pregnant? Spoiler alert, I'm not pregnant. We're actually talking about whether or not you're pregnant and how you can tell if it's just a late period, pregnancy, or something else. And stick around to the end to find out what you need to know about polycystic ovarian syndrome. So let's talk about skip periods and PCOS. So question from viewer Abimanika regarding what if she's 7 days late for her period. So first of all, there are many reasons other than being pregnant that you could skip your period. So some of the most common reasons include polycystic ovarian syndrome, being on certain medicines like birth control pills, stress, strenuous exercise, rapid weight loss, significant weight gain and obesity, menopause. So the most common reason for a skipped or late period is going to be that there's pregnancy. So you can do that with a simple at-home pregnancy test and rule that one out. As far as the other causes, the body has a baseline or a thermostat that it's set for its metabolic function. It expects the hormones to function in a certain way, in a balanced way. And there's a cycle of hormones that start in your brain and then talk to the ovaries, and then there's a feedback. Now, when this balance point gets offset, the body perceives that as maybe not the best time to get pregnant, or an unsafe or an unhealthy. And so an example of that would be rapid weight loss. Maybe the body says, pump the brakes, let's not have a period this month because it doesn't seem like, it's healthy to get pregnant. Or excesses of metabolic activity like endurance athletes or athletes that burn a tremendous amount of calories will spontaneously stop having their periods because the body wants to preserve all of that metabolic function to preserve your own function and not take on an additional passenger at that time. So most of these we can kind of lump into the category of hypothalamic dysfunction, meaning that the brain hormones that feed the ovary hormones aren't balanced out, and so your body says, not time to get pregnant, stops making the ovarian hormones that are needed to have your period every month. And providers may not do the best job of educating around this, but there's certain pills that are designed to cause you to skip periods, like injections or certain tiered birth control where you get 90 days worth of pills per pack. And those will cause you to not have periods for 3 months in a row. Certain low dose pills or extended dose pills throughout the 28 days of the pill pack. A common side effect of that dosing is you will skip your period. So certainly if you're on a pill or some other type of contraceptive like an implantable rod or an IUD or an injection, you want to talk to your provider to see if that would be an expected result for that type of contraception. And the last thing that I'm going to spend a little bit of time on, because it comes up a lot, is something called polycystic ovarian syndrome, or PCOS for short. Now, many people have heard this term, but really don't have a good understanding what it really is. So within the ovary, estrogen is made. This is what we think of as a female hormone. But what most people don't realize is that female hormone started off as androgen, or a male hormone, and it's converted within the ovary into estrogen. So it goes from androgen to estrogen. Now, there's too much androgen in this condition called polycystic ovarian syndrome, so much so that it can't all be converted into estrogen. When we have excess male hormone, it creates an environment where the eggs or the ova don't grow, don't mature. When you don't have an egg that to ovulate, when ovulation does not occur, then the body does not have the signal to have your period, and you can go many months in a row without a period. And when there is no ovulation, the ovary does not produce the second female hormone, progesterone, and that can result in 1 or many months without a period. That is the basic hormonal or endocrine or metabolic reason that polycystic ovarian syndrome causes you to skip periods. So what is the result of that? What are the effects on your health, and what are the things you need to be aware of? Number one, uterine hyperplasia, uterine cancer. Suffice it to say that if you go many months without a period with too much estrogen and not enough balancing progesterone, you grow the thickness or the lining or the growth in your uterus, which can eventually turn into cancer. So if you've gone a year or more without a period and you're not on birth control, you need to talk to your doctor to rule out anything bad like hyperplasia or cancer. Number 2, infertility. So the same reason that you don't have a period is that you aren't ovulating with polycystic ovarian syndrome. If you don't ovulate, you don't have an egg. If you don't have an egg, there's nothing for the sperm to fertilize and then implant and then become pregnant. So many women with polycystic ovarian syndrome will go months and months or even years without being able to get pregnant. This is why. Now, the good news is with weight loss and or medicines to cause your body to ovulate that your doctor can give you, most often this problem can be overcome. Now, there are many other causes of infertility, and you would need to have that worked up in addition to the polycystic ovarian syndrome. Number 3, there is a lifetime increased risk of other conditions like metabolic syndrome, hypertension, bad lipid profile, cardiovascular disease, insulin resistance and diabetes. All these can be linked to polycystic ovarian syndrome and obesity, so these are things that need to be managed on a chronic condition early on to prevent any of these problems from developing. So what are the symptoms of polycystic ovarian syndrome? Well, we talked about skip periods, but you should also be looking out for signs of excess male hormone or androgen, which could include hair growth and acne. Obesity is a commonly associated with polycystic ovarian syndrome, as well as certain skin changes, specifically darkening of the skin on the neck or in skin folds under the breast. So how do we make the diagnosis? Diagnosis is simple. Number 1, polycystic ovaries appearing on your ultrasound. Number 2, excess androgen, hair growth or abnormal testosterone on your lab test. And number 3, skip periods. You have to have 2 of those 3 things, you have the diagnosis of polycystic ovarian syndrome. This is known as the Rotterdam criterion. So how does your doctor make the diagnosis? On clinical exam, history, lab work, and ultrasound. With a combination of that evaluation that match the criteria we discussed, they can make the diagnosis. But beware, if this is not something that your doctor typically deals with, they can often miss the diagnosis. Also, keep in mind there are many other causes for infertility. There are many other causes for acne and hirsutism. There are many other causes for skip periods and obesity. But when we see those combination of symptoms together, it does often point to PCOS. So if you have a skip period and you're not pregnant, these are likely diagnoses, with polycystic ovarian syndrome being a common cause. This is your 5-minute primer. Hopefully you found this helpful. If you have any other questions, drop them in the comments section below, and please remember to subscribe.